Hi, my little man. Hi. Hey. Are you good? Are you good? Are you good, my bubbas? Are you good? Yes, you are. I love you. I love you. Hi, guys. Welcome back to my channel. I did the very first video, and that first video was about me being diagnosed with breast cancer at the age of 30. So hopefully you guys have watched the very first video. And so this is just like a continuation of how things are right now. So after I was diagnosed and I went through my treatment at the age of 30, that was like 21 years ago. And so a lot of time has passed. Cancer free for 21 years. Amazing. So I'm going to now kind of let you in on what's going on currently in my life. So, with the first diagnosis, I had radiation therapy. So, I never had any kind of chemotherapy. I had radiation, and then I was good and I moved on. My breast that had the cancer, I had 2 lumpectomies, and so it pretty much was half of my breast that was removed. And so, for a very long time, I definitely, would wear clothing that didn't show it up as much, or I would avoid wearing certain things, or I wore a lot of scarves, thin scarves. I just wore clothes that would kind of cover it up because at the time, like I said, I was raising my family. I didn't have time to put all that effort and energy into myself, and it wasn't really a huge deal for me at that point. So you fast forward now to 2019, my kids are all grown, and I'm like, it's my time. It's my time to do what I want to do. And so I decided that I would get that breast that had the cancer, I decided that I would get reconstructive surgery to rebuild it. And so I was referred to a plastic surgeon in my area who specializes with dealing with reconstructive surgeries for cancer patients. So she's very good. And so, yes, I successfully did a breast augmentation in November of 2019. And so, what they did was they put an implant into the one that had cancer prior, and they did a reduction to the normal one. So to try to kind of, balance out the sizes. And so I went through that, and it wasn't 100% balanced. So it still needed a second surgery. So I went back. We had a second surgery November 2021. And in November 2021, they balanced things out so it looked much better. And I met for follow-up appointments with her, and everything seemed fine. I didn't have any issues. The only issue that I had was that I mentioned to her that I was getting stretch marks on that breast with the implant, and the stretch marks were a little bit different than what a normal stretch mark would look like. So she did take a look at it, and she was like, no, everything's fine. It's very natural that your skin would stretch after putting in an implant because they had to stretch it, yada yada. No concerns. Okay. About 4 months later, I was scheduled for my normal annual mammogram. So since being diagnosed years and years ago, I do mammograms once a year as a follow-up, just to make sure everything's good, and that's common practice. Other people that have breast cancer do the exact same thing, I am sure. So I went in for my scheduled mammogram, and about 3 days later, I was called back by the mammogram team that they saw something and they needed to have me come back in to do another imaging. But they were actually talking about the other breast that never had cancer. So I was like, oh, wow, okay. But at the same time, it didn't bother me. I really didn't think too hard on it because they do recall people quite often. and it ends up being nothing. So I was like, okay. But I was a little bit like, this breast never had anything. So, okay. Anyway, they booked the appointment for me to come back and redo the mammogram in a week. In the meantime, I guess it's probably because they called me to tell me that they were concerned about that one, or that, in fact, they never said they were concerned. They called me to tell me just come back and do another imaging. But in my mind, because of that, I started looking at my breast. And when I actually went to do a self-inspection, I mean, I didn't feel anything. There was no lumps. But what I noticed was that my right breast, the one that did previously have cancer, wasn't looking that great. So what I mean by that is the shape had changed a little bit. The skin had changed. The skin almost had like an orange peely type of skin. The nipple was a little bit retracting, and I had like a bruise, like a reddish, purplish, bluish mark on across it. And I want to say that I noticed it before, but I kind of overlooked it because I was like, oh, it's the implant. I have an implant in, and it's probably causing that to look that way. Not a big deal. I had a little bit of discomfort in my breast at times, but then my thought was, I had surgeries and I'm still healing, and because healing can be like up to a year. And I was like, sometimes I get like stabbing pain or just an achy feeling. And I'm like, it's just because, they've been tortured, really. So I would overlook it. In addition to that, before this all happened, my husband was going through something medically, and we needed to find out what was going on. He wasn't well, and there was all of these specialist appointments and all of these crazy things happening. And so I was really wrapped up in making sure that he was okay, and I was really focused on his diagnosis and how can we learn more about it, because it's very rare, and how can we just focusing on him. And so if you were to ask me when I noticed the breast change, I honestly can't even answer that because my head was just in a different place. So anyway, back to the fact that I was self-diagnosing myself. So I did my feel and so forth. I didn't feel any kind of lumps in any of the breast, not my left, not my right. And the only thing I noticed was that it didn't look good. So I took photos, I took some pictures, and then I called my husband and I showed him, and he's like, that doesn't look good. You should really probably go to emergency and see what they think. And I'm like, emergency? Really? And he was like, yeah, you need to go to emergency. And I was like, no, you're being silly. I'm not going to emergency. And then a couple days later, my girlfriend came. My best friend came to spend some time with me. And I showed her the photo, and she was like, that doesn't look right. Like, you really should go and take a look at that. And I'm like, no, I'm not going to emergency. That's just silly. I said, what I will do is I'll call the office of the plastic surgeon and I'll go and see her. So I called, but unfortunately when I called, the office was not going to be open for the next 2 weeks. So I'm like, okay. So my friend says to me, you know what, we'll go first thing in the morning to emergency. That way you're not there all day. They can take a look at it, see what's up. Could be nothing, could be something, but I don't think that you should be ignoring it because it shouldn't look like that. And I'm like, yeah, you're right, it shouldn't look like that. So anyway, she managed to coerce me to go. And so the very next morning, we went up to the hospital, and when I was there, the doctor came in, he did a physical exam. I showed him the photos that I had, and he was quite concerned. So he told me to come back the next day. He was going to book an ultrasound. And I was to come back the next day for that ultrasound. And then an hour later, I can go back to emergency to get my results. So I was like, oh, okay. So the next day we went up, I did the ultrasound, waited around for an hour, went back over, and had to wait a little bit because, you know, it's a hospital. So I was there for like another 2 hours or something. And then the doctor came in, the ER doctor came in and basically read me the report. And what it said was that I had 3 areas in the right breast, which was the breast that previously had cancer. That was concerning. And they felt that it could actually be a type of cancer that is created by having a breast implant. And so I was just like, okay. So she says, we're not saying that's what it is, but you do need to look into it further. So we're going to recommend you over to our cancer center. So of course, when I hear that, I'm like, if it's not cancer, why am I being referred to the cancer center, right? Anyway, our cancer center is phenomenal. It's relatively new, state of the art. It is beautiful, and a lot of people from far and wide come to our cancer center to be treated. So it's very well known and, you know, very well appreciated, I'm sure. So anyway, they recommended that I go over to this team, this cancer center. And so I had an appointment, I think it was a few days later. I had an appointment with them to go over and talk to the doctor there. So I went over, I talked to the doctor. So basically, she was like a part of like a diagnostic team. And what they do is they create or they book all of these appointments that they feel that you'll need in order to be properly diagnosed. So my file was now with them. So they booked for me, what did they book for me? After I had the ultrasound, they booked an MRI. So I had an MRI. And oh my God, the MRI was just so, it was painful actually. Because what they do is I climbed up on all fours, and then I had to lay down forward on my chest, and my breasts were hanging between these 2 holes, right? Where they can get proper imaging. But it was really uncomfortable and really painful for me because for some reason my breast hurt. Like it was, you know, the breastbone by itself was, it was painful. So I was not liking that. But anyway, it had to be done. So I did the MRI, and after the MRI, they decided based on the findings of the MRI that they would do an ultrasound guided biopsy. And they wanted to do it on both breasts, not just the one that I had gone into about. In the meantime of all of this, I had gone back to the mammogram people to have a second mammogram that they initially requested on the breast that never had anything. And they never called me back. They never called back to say, oh yeah, we found something or we've confirmed. Nothing. I didn't hear from them again. So I was just focused on being in this diagnosis team where they were just going to take care of me from here on in. So when I had the MRI, they did focus more on the right because that was the one that was diagnosed with the 3 spots or the 3 areas, but they also did take imaging of the left, which was good. So anyway, after the MRI results, they never even told me what the results were. They just said, you know, yeah, there are 3 areas. They never once used the word cancer to me. So they booked an ultrasound. A guided ultrasound biopsy. So I went in for the biopsy a few days later, and it was so painful because it wasn't a needle biopsy. It was actually, what do they call it? Like a staple gun biopsy. So they literally go in and just like staple a piece of the tumor off and send that away to pathology. So they did that on both sides. And it was painful, I'm not going to lie. But it was necessary. And so when they send it off to pathology, you have like a whole week that you have to wait for the results. And honestly, that was the worst week ever because, you're sitting around waiting and you have time to just think of all these things that could be, the results. And I'm Googling like mad, thinking that I have this other type of cancer, like maybe my implant ruptured. And it's just like I Googled so much and made myself so crazy. My girlfriend was like, you need to get off Google, okay? Like, get off Google. So anyway, yeah, the worst 7 days ever. So after the 7 days, I actually got a phone call from my family doctor because the results went to him, and he confirmed. It was that day, June 13th, that he confirmed to me that I did indeed have breast cancer again. And they felt that there was concern also for the other breast, and that I was in good hands dealing with the cancer center, and he was going to, just kind of release me over to them, and they would be the ones to kind of take care of me from here on in. So we confirmed that I had breast cancer. Okay. I wasn't extremely surprised. I wasn't even terribly emotional about it. I was just like, okay, well, what do we need to do, to fix it? So after being diagnosed, I had an appointment with the actual doctor leading the diagnostic team at the cancer center. And so she kind of talked to me about potentially what things could be. I told her what I was feeling. And at the time I was feeling something really strange. It was like I literally felt my lymph nodes were like draining from my neck into my chest. It was the weirdest feeling. And it didn't happen constantly, but it happened, enough for me to be like, what is that feeling? So anyway, I did mention that to her. She did a physical, and then she told me that she was going to book some other exams for me, or some other tests for me. And then I went to, I think it was a CT. I had a CT. No, before I had the CT, I met with another doctor who confirmed to me the name of the cancer. So the name of the cancer is triple negative invasive ductal carcinoma. Triple negative meaning most breast cancers are treated with hormone therapy, but mine is negative and would not respond to hormone therapy. So that was the name of it. I wasn't really familiar, but of course, as soon as I found out the name of it, I was on the internet trying to read up as much as I could about it, which I'm okay with because then you actually have a diagnosis and you can actually read valid, information about that type of disease. I'm not just pulling things out of my hat. So anyway, they diagnosed me with that. And then after that, I was scheduled for a CT. And so I went in and I did the CT. And then a couple days later, I met with the surgeon in the cancer center. And so the surgeon in the cancer center, she was awesome. She talked to me about my options. I said to her right off the bat, I want a full mastectomy. I want them both gone. I'm over this. Like, I don't want this happening again. And she said to me, if you are looking to be preventative, if you're doing it to be preventative, to remove the left as well as the right, then there's really not much more risk in doing that, because she said the type of cancer it is, if it does come back, more than likely it's only 10% going to the breast. It's much more likely that it would go somewhere else, like the lung, the brain, or somewhere else. So because we hadn't confirmed anything was happening in the left, they actually thought it was just like, what did they tell me? They thought it was just a fibroid. And so she felt that it would be drastic to do a mastectomy on both. And so we agreed that for now it would be the right breast with the huge problem. We would do a mastectomy on that. And she explained to me the whole process and, the whole option of putting in, doing reconstructive surgery at the same time of surgery. So she would remove it and then reconstruct it. And the options were, again, to put in another implant or to rebuild it with your own tissue. And I was like, I absolutely, without a doubt, do not want another implant. Because in my mind, I was like, the mammogram didn't pick up any of these tumors in this breast. And in my mind, it was like the implant had hit it. So I was like, why would I put another implant in? So anyway, so I decided that if I did the reconstructive surgery, it was going to be my own tissue. So she explained to me that I'm going to, she was going to take the bottom part of my tummy. I have some. And that she would cut that. She would use that to rebuild the breast. And it would be much more natural. It would, gain weight if I gain weight, lost weight if I lost weight. It would be like it was me. So a part of me on the breast to rebuild it. And I was like, okay, well, I like that. I like that idea. So that's what we decided on doing. After I met her, a couple days later, we booked an appointment with the medical oncologist. And he was also amazing, very knowledgeable. And he, again, went over my diagnosis with me. He explained everything. And he basically said to me, because I guess the CT or a part of the CT had come back, that my brain was good or my head was good. But they noticed that there was a spot on my breastbone. And so he felt that it's necessary that I go through chemotherapy first. So it's going to be a 12-week regimen on chemotherapy. And it's all these different medications that I can't even pronounce. But he did explain to me that we were not going to do surgery first, as we previously thought. We are going to do chemotherapy first, and he will be the one in charge of that. So he'll be my medical oncologist. And he's a great doctor. So I feel okay with that for sure. After I met with him, a couple days later, I met with a radiologist oncologist. I actually talked to her on the phone. And my concern about radiology was that radiation. Radiation. My concern with radiation was that I had previously had radiation. And so I was concerned. I'm like, well, I've already had it. When I had it the first time at 30, I was treated for 5 weeks, Monday to Friday. 5 weeks, 6 weeks. I was treated for 6 weeks, Monday to Friday, and it was aggressive radiation. So I was like, can I get radiation again? Because, I already had it. But she explained to me that it was years ago, and because it was so long ago, that I would be fine. And she wasn't concerned about exposing me to additional radiation. That wouldn't be a concern of hers. So I was like, okay. I also met with a plastic surgeon, which was my plastic surgeon, which was interesting because when I had originally met with the general surgeon, she mentioned she's going to remove it, and the plastic surgeon team was going to be the one to do the rebuilding. And she mentioned that there were only 3 or 4 doctors that actually did that type of surgery because it's very unique and very difficult to do, but they did specialize in it. And I didn't realize that my surgeon was actually one of them. So my plastic surgeon was definitely on that team. And so they called me, they booked an appointment. I went in and I spoke with her, and she was like, I can't even believe that this is what's happening, that you have breast cancer. She's like, it's the last thing that I would think of. So anyway, I talked to her about what is going to happen She explained to me the procedure and the, what's that all entails. And I felt fine. Um, and so at this point, I had so many tests under my belt. It was just insane. I felt a little bit overwhelmed, but at the same time, I felt really, really blessed because I know that there are patients who, they're diagnosed with something like this and it takes just forever to get diagnosed, to get tests and exams booked, so I felt really, really blessed that they were paying such close attention to it and that they felt that they had to move on things very quickly. So all of this happened, I would say, within from the time I went to the ER to the time that, we have all of this in place, that this is what's going to happen. It's been about 5 weeks. And I actually start chemotherapy this week. So within 2 days of recording this, I will be having my first chemotherapy treatment. And so I wanted to kind of share that journey with you because I know it was a lot and I know I babbled on about a lot of things, but it's really important that when you're diagnosed with something like this, that you have an expectation or that you know what type of testing really should be happening, right? So that you're aware of it and steps are not missed. And the biggest thing for me is that there's so much thought around, breast cancer. If you have a lump, go and see your doctor. Always do your checks. And if you can find a lump, don't ignore it. Go and see your doctor. 100%. That is absolutely true. However, in my case, there was no lump. None that I could feel. There was no lump that I could feel. There was no lump that I could see in either of my breasts. And so the only thing that drove me to go to the ER was what I mentioned, the physical change that happened with the breast, with the discoloration, with the skin changing, which the nipple retracting a little bit. And I honestly should have been paying more attention, but as I said, life was just insane and crazy at that point that I'm sure I overlooked it for probably a good couple of months before really taking a look at it and examining myself. So I just want to dispel the myth that breast cancer always has a lump that you can see and feel, because that's not the case. And doing your self-check is extremely important, and noticing any changes in your body is really important. Take note of that for sure. What else do I want to tell you guys? I think really just at this stage that it's just really important that people also understand that everybody has different symptoms. Everybody has different, they experience different things. Like what I experience may not be what you experience, right? God forbid you ever have to experience it. But for me, it's like I had breast pain. And right now, I still have breast pain. My breast pain is like achy. I would say it's like an achy feeling at times. And then sometimes I feel like it's like sharp, like stabbing, like sharp moves like that. And I'm like, why do I feel that? But it definitely happens, and I feel it in both. So the fact that most people say, or most doctors would say, breast cancer shouldn't hurt, breast cancer doesn't hurt. A lot of the times, no, it doesn't. But that's not for everyone. And I'm telling you, I have breast cancer and my breasts hurt. So again, don't ignore things like that. Don't get so upset and crazy thinking that you automatically have breast cancer, because a lot of the times, our breasts just go through things, and it doesn't mean anything. It's just part of being a breast, I guess. But it's something that you shouldn't overlook. You should always look into it for sure. So I guess that's all I really wanted to talk to you guys about, let you in on my journey so far. I was cancer-free for 21 years, and now that has come to an abrupt stop. So, I was extremely emotional, but I've had a good few weeks to kind of digest and absorb what's going on and what I was diagnosed with. And so the journey begins. I am 100% going to beat this. I'm going to give it all that I got. I've never had chemotherapy before, but I'm very, nervous about it, but I know that I'll be fine. And I'm doing my homework on what to expect. Again, blogs like this, people do their own blogs, and I'm so incredibly thankful because I know, like I said, not everybody has the same type of symptoms and responds to medicine the same way, but at least I have knowledge and at least I have a little bit of insight on what to expect and little tricks and tips on what to do and what not to do. And so I'm definitely going to use all of that. And the journey begins. So I do start chemotherapy for 12 weeks. I start in the next 2 days. And so, yeah, that's where I am right now. I hope this helped someone. And if you can share or subscribe and just, stay on this path or stay on this journey with me, we're going to do it. We're going to do it. Thanks for watching, guys. See you next time. I forgot 2 things that I have to mention to you guys as well. Okay, so one of them, my doctor did in fact book me for a bone scan, and I did that and it came back negative. Yay! In addition, my CT scan, I guess all of the results came in, and he did see some parts of it that were a little bit concerning. So he left me a message that I was booked for an emergency PET scan. And what a PET scan is it's like a CT scan, but it's much more detailed. And so what they do is when you go, they give you an IV, and the IV has like glucose in it, which is like, it has sugar in it. So they let you sit with that for a little bit. Then they take out the IV, and then you have to wait for a little bit for it to get into your body fully for like an hour. Then you take the scan, and the machine that they use for that is very similar to like a CT machine. It probably is the CT machine. I don't know, but it's very similar. And so basically, by giving you the glucose, what happens is that when they take the image, because cancer loves sugar, the image that they take will capture the hot spots in your body that the cancer could potentially be at. So the medicine that you took, the intravenous that you took before, allows the cancer to be highlighted on screen because it will jump to those areas. So apparently that's why he sent me for it. And I don't really know much about this type of scan because I've never had it before. But I am currently waiting those results. So he should have it. I actually do have an appointment with him tomorrow, which is the day before I start chemotherapy. And so I will have the results from that. And hopefully they are clean and they're good. But on my next video, which I will connect with you guys, and I'm sure it'll be around the time that I do my chemotherapy, I will share those results with you as well. Thanks for watching again. Bye.